Hello viewers, in today's video we will talk about radial nerve. In previous videos on this channel I have talked in detail about brachial plexus, about the cutaneous sensation of the upper limb, about median nerve, and I've also talked about ulnar nerve. So today we will talk about another important peripheral neural branch of the brachial plexus that is also the largest peripheral branch of the brachial plexus, which is the radial nerve. If you want to understand radial nerve, you have to associate radial nerve with the word posterior. If you think of the word posterior, the moment you hear radial nerve, then it will be easy for you to remember what radial nerve really is. So radial nerve is a continuation of the posterior cord of the brachial plexus. So posterior cord is formed by the union of the three posterior divisions from the three trunks of the brachial plexus. So the root value of radial nerve are all the roots in the brachial plexus, that is C5, C6, C7, C8 and T1. Now radial nerve, unlike median nerve and ulnar nerve, does give branches in the axilla. In this video I will not talk about the sensory branches of the radial nerve. I will only talk about the motor branches. For the sensory branches of radial nerve, as well as all the nerves responsible for carrying sensations from the upper limb, please check out my video on cutaneous sensation of the upper limb. So coming back to radial nerve, it does give branches in the axilla. The motor branches of the radial nerve in the axilla are to the medial head and to the long head of triceps brachii muscle. Now triceps, as the name suggests, has three heads. Medial head and long head get supply from the radial nerve in the axilla, and the lateral head of triceps gets supply from the radial nerve from the spiral groove of the humerus. The spiral groove lies in the posterior aspect of the humerus, and radial nerve passes from the axilla to enter into the posterior aspect of the humerus through the lower triangular space, where it is accompanied by the profunda brachii artery. I have talked about the upper triangular space, lower triangular space and quadrangular space in my video on intermuscular spaces in the upper limb. So now that the radial nerve is in the arm, that is from the shoulder to the elbow, it lies in the spiral groove, and then it passes through the radial groove to reach the anterior aspect of the lateral epicondyle. Before reaching the anterior aspect of the lateral epicondyle, it gives out motor branches. Radial nerve gives out motor branches to brachioradialis muscle, extensor carpi radialis longus muscle, and extensor carpi radialis brevis muscle. So these three muscles are supplied here, and extensor carpi radialis longus and extensor carpi radialis brevis are important for extension of the wrist. Triceps muscle is important for extension of the elbow joint. Now once the radial nerve is in the forearm, it enters the forearm between the two heads of the supinator muscle. It divides into two branches: the sensory branch, which is superficial, and the motor branch, which is deep and is called the posterior interosseous nerve. Posterior interosseous nerve supplies all the muscles in the posterior compartment of the forearm, that is the extensor compartment of the forearm. So all the extensor muscles are supplied by the posterior interosseous nerve, all the extensor muscles of the forearm, that is even muscles like extensor carpi ulnaris. Now the muscles that are not easy to remember in terms of the supply is supinator. Supinator also receives motor supply from radial nerve. Now radial nerve enters the hand, and in the hand radial nerve does not provide motor supply to any muscles. In the hand, radial nerve is only responsible for carrying sensations. So it's only sensory function in the hand. Most of the muscles of the hand are supplied by the ulnar nerve, and some muscles are supplied by the median nerve. Which muscles? First and second lumbricals, and the muscles of the thenar eminence, that is opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. In terms of injuries to radial nerve, there can be very high radial nerve injury, high radial nerve injury, low radial nerve injury, and Wartenberg syndrome. Very high radial nerve injury is compression of the radial nerve at the axilla. This will result in compromised sensory and motor function of the radial nerve below the axilla. So there will be loss of functions to the triceps muscle, resulting in loss of elbow extension. There will be loss of extensor muscles to the wrist, so there will be wrist drop, that is loss of wrist extension, and the finger extension function will also be lost, so finger extension will also not be present. If the injury happens at the spiral groove or at the distal third of the humerus, then triceps is largely spared, so the main symptom will be loss of wrist extension and loss of finger extension. This is high radial nerve injury. If there is low radial nerve injury, that is injury to the radial nerve below the elbow joint, which may be due to entrapment of the radial nerve at the arcade of Froese, or maybe due to Monteggia fracture, then radial nerve, the extensor function of the wrist is preserved, because this is through the extensor carpi radialis longus and extensor carpi radialis brevis muscle, which is above the elbow joint. These branches are given above the elbow joint. So wrist extension is still happening. What is lost is finger extension. So if there is injury to the radial nerve below the elbow joint, the only motor function that is lost is the extension of the fingers. Now, if there is compression of the radial nerve at the wrist, which is known as Wartenberg syndrome, then the only symptoms are sensory, that is the sensations of the dorsal aspect of the hand, which is provided by the superficial branch of the radial nerve, that is lost. And there may be a feeling of pain at the Wartenberg's point, which is roughly 8 centimeters proximal to the wrist joint. Now, I have not talked about the cutaneous sensation. The cutaneous sensation of the upper limb has been discussed in detail in a separate video, and depending upon where the injury has happened, then that corresponding area or the area below that or distal to it will also have compromised sensory supply. Okay, so I hope you liked the video on radial nerve, and I would urge you to watch this in conjunction with the videos on brachial plexus, median nerve, ulnar nerve, and definitely cutaneous sensation of the upper limb. In the next video in this series, I will talk about the final two important peripheral branches of the brachial plexus, that is the axillary nerve and the musculocutaneous nerve.